Good evening, everyone. Welcome to On the Couch for this week. This week we've got three special guests joining us. They're all some of our frontline workers here in the Penrith and Nepean area. Our first guest tonight is Barb. Barb, you're involved in the theatres?
Yes.
At Nepean Hospital?
Yep, I work in the operating suite. I've been there for nearly 7 years, which is quite surprising because time seems to fly. I didn't realise it was that long.
Now, with COVID, what has that meant for life in the theatres?
There have been huge changes in theatres. To start with, we were doing elective cases and emergency cases and trying to learn new processes because everything changed with COVID. Then they decided to cease elective surgery, but not all elective surgery. Even though the public believes there's no elective surgery happening, it's still happening.
So things got pretty quiet for you?
It got very quiet from an operating point of view, but from a process point of view, it got very busy. Things were changing some days hourly.
In terms of what was required of you?
What was required, what processes we had to do, what changes needed to be made. One of the biggest things is they stripped everything out of the operating suites, which is, it makes life very difficult. So you've got to make sure you're very prepared because you can't leave a room once a COVID patient starts.
Right, so all the operating suites or just some specialised COVID operating suites?
We have 14 theatres in total, of which 6 are COVID theatres. So basically they still do normal surgery in them, but if they have a COVID patient, the cleaning and everything is completely different.
2 identical surgeries, one for a COVID patient, one for a non-COVID patient. What's the difference from go to woe in those surgeries? Time-wise,
you're probably looking at 2 to 3 times longer. Even from calling for a patient, normally they have a patient in the anaesthetic bay, and then they come in. That doesn't happen. They have to wait until everybody's ready, then they go and get the patient.
And for the staff, how have they coped with all of that?
The first couple of weeks was really, really stressful because, as I said, things were changing hourly. The health department was making changes. The hospitals were trying to implement those changes. You had, people on Scott Morrison saying, right, there's going to be no elective surgery, and then everybody comes to work the next day and go, but we're still doing things. And we go, well, yeah, the processes have to go through. Then it all settled down and it got to the stage where we're sitting there twiddling our thumbs going, okay, where are all these patients? We've only had maybe half a dozen COVID positive patients, so which is good because it sounds bad, but it is really good that all the processes they've put into place have worked. So therefore, we haven't had this onslaught of patients that they were expecting. And now we're starting to increase the number of cases for elective cases, and we're not back to normal. We're not going to be back to normal, I gather, for quite some time, but at least there's more to do.
Personally, your processes in terms of uniforms and what you wear to work and cleaning and...
Yeah, well, a lot of people aren't wearing their uniforms to work because they have been hassled, which is a real shame. I haven't heard as many stories of that as in the early stages.
So people in the public were...
Yeah, saying that nurses, you're in uniform, you're spreading the disease.
Right, okay.
Which is,
that paranoia of the early days
and
the
I think
unknown.
it was the paranoia and people just didn't understand and they were just so stressed and they saw the blue uniforms and they went, oh, you're a nurse, you must be, you must have been in contact. Whereas I knowingly have never been in contact with a COVID patient.
Right.
But I still made changes to what I do. Like as soon as I get home, I have a shower and get changed. I'm lucky in that working the operating suite, I wear my clothes to work, get changed into scrubs, and I wear that all day. You take them off when you go home. So it's not so bad for us.
Yeah.
Whereas the girls on the wards would obviously be in their uniform all day.
And stress life for family members? Have family members been anxious or worried about you at work?
They've been anxious, and actually some of our congregation have been very anxious of, to make sure that we're okay and that we're not being exposed. My family have been really good,
Yep.
about making sure I don't have to do anything, which is nice.
Lovely. Well done.
So, we're in the situation where Ken's at home at the moment, so he's pretty much been doing most of the stuff. So I pretty much at the moment get up, go to work, come home, have a shower, get changed, watch some TV, have dinner, go to bed, and do the same again.
Well, Barb, thank you so much for coming and joining us on the couch. It's been lovely chatting with you, and we'd really appreciate it if you could pass on our thanks to the teams you work with down in theatres for all the efforts they're putting in and the extra lengths they're going to love and serve and protect our community during this time.
No dramas.
Well, our next guest is Louise Smith. Louise, whereabouts in the hospital do you work?
I work at Nepean Hospital in the intensive care unit, but specifically in the cardiovascular lab, which is part of the ICU.
So for laymen, you do ultrasounds on hearts and yep. So how has COVID-19 impacted your particular area?
Well, hugely. With everything that was happening overseas, we were really conscious of what was going to happen here in Australia and how that was going to affect us, particularly in looking after our communities, and were we able to sort of service our communities in looking after the critically ill.
So a lot of just anxiety about the flood of people that might come?
Yeah, there's a lot of anxiety about, how many we're going to get. Are we going to have enough staff? Are we going to have enough beds? Are we going to have enough equipment? Those sorts of things. But I've been privileged in working in an intensive care department where when the chips are down, everyone gets together and works really, really well. And so we were able to do that very effectively and very efficiently. And so Nepean is ready for the wave, the second wave, if we get it, that we will have up to 3 ICUs, that we will be able to have beds, equipment and staff.
To put into place if we need it.
To put into place. So we even outsourced other staff that used to work in ICU that have moved on to other things, and a lot of us have had refresher training in just a few things. So there's a lot that's gone in over a very short amount of time to get everything ready so that we can look after the critically ill. And
so the ICU, one of the fears and anxieties was just how many patients would be coming through. How was that sort of first? Was there a first burst? What was it like down in the ICU?
There was a burst, and we actually did close off ICU 2, so that became a closed COVID ICU unit. So it was separate from ICU 1. It was very different because there's to go into that ICU, you have to put on all the gear, which is called donning.
Right.
And then do what you have to do with your patient. And then when you finish, then you've got to do what they call doffing. And the doffing takes some time to do because you've got to take off one layer at a time and slowly, and then you've got to wash your hands in alcohol type.
I was speaking to Barb earlier tonight, and she's in the theatres, and she was saying when you're working with the COVID patients' operations, it's 2 and 3 times as long to get through the procedure. It sounds like
it is
the same with ICU.
Yeah, it is. It's very much like that, and sort of when you're finished, just the doffing procedure is long, and then it's cleaning down everything. So
for the ICU with ICU 1 and 2, was there effectively a staff and staff and nurse and staff?
Teams.
Yeah. Separation.
So we had to look at the teams, and our managers had to look at our staff mix, because you want to have experienced staff in there as well, but not deplete the other side of not having experienced staff. And also, we all have families and we all have people that we care for, so we had to look into our social status in who has children, who has sick children, for instance. Like one of my colleagues, she's got a child that's got a lung condition, had a lung replaced, so she wasn't to go into the COVID patients, and our pregnant nurses as well, so we kept them away as well, and also our nurses that were, shall I say, in the mature age group.
Yeah.
Now,
when I've been to the hospital, I'm having to get thermoscanned for my temperature and getting asked, have I been in contact with any COVID patients, and like, how did you get into the hospital? I'm assuming you've got to say, yes, I have been. Like, how did the door checkers cope with that?
So anyone coming into the hospital needs to be checked, and a series of questions are asked. And when they first started asking the questions, they actually said to me, so have you been in contact with anyone with COVID? And I went, yeah. And the look was like, like they didn't know what to say. And I went, oh, look, I work in ICU. And they went, oh, okay, that's fine.
But, I mean, I suppose it's a serious thing, like movement around the hospital and...
Yeah, so it is serious. And for the likes of myself and some of my other colleagues in the lab, we're not just confined into ICU. So we actually move around the hospital. And so I developed a roster where we allocated a specific person to be the COVID person for the day. And they were to do all the COVID patients. And if we were short-staffed, we tried to keep the COVID patients till sort of later in the day so that we weren't cross-contaminating and that sort of thing. And so we wear scrubs as well. And
so again, just being wise in and trying to be efficient with everything that needs to be done.
Exactly. And so, like with the machine itself, we dedicated a machine called the COVID machine. It's got labels all over it.
It feels like in the community, it feels like a bit of a lull now, and an eagerness to go, can we break through this and head towards normality. What's the sense and the feeling in and around your departments and ICU?
Well, it's funny that you asked that question, because one of the girls this morning sort of was in the hallway and said, it's a bit of an eerie feeling in the hallways, isn't there, at the moment? And there was earlier too, when everything was so hyped up. But it's like the anticipation, like we're waiting. We're waiting for the onslaught to happen. And nobody knows. Nobody knows what's going to happen. Really.
It is that unknown, isn't it?
And so again, what do you focus on? Do you focus on the unknown, or do you focus on what you know?
Sounds like almost a lead into a gospel explanation there, and the certainty of the hope that we have in Christ and the surety of where we're going. Louise, thank you so much for coming and joining us on the couch. Please pass on our deep thanks to the teams that you work with, and our appreciation for all that they're doing on the front line, for loving and caring and looking after our community.
I certainly will.
Thanks for joining us. Peter, thank you for joining us on the couch. What sort of nursing are you involved with?
So I am currently an enrolled nurse. I work Monday to Friday for Fairfield primary health and community. So I'm in people's homes doing nursing care, and then on weekends I've been manning the COVID screening clinic at Nepean.
And so obviously I was going to say, how has COVID impacted your work? It's given you a weekend job. How has that been working in the clinic? Like, how have people been? How have the colleagues been? What's been the feeling?
Oh, look, there's always outliers and who have made things fun. And I put that loosely in quotation marks. But generally people are just uncertain. They're trying to do the right thing. They're not sure how to do the right thing. And they're really... I think we've been very lucky in Australia. People are looking for guidance and they really want to do the right thing by themselves, by their families, by their communities. So really they're just looking for some encouragement and some guidance in how to stay safe and how to keep other people safe.
And is there much in the way of anxiety amongst the nurses and the staff who are doing the testing?
In the testing clinic, we're pretty geared up. We've got a lot of PPE available to us, which has been really great.
That's the
personal protective equipment.
Yep.
So from that perspective, we kind of go in ready. We know that there's potential for COVID there. So we go in ready, we go in serious and treating it, you know, in a really clear and distinctive way. There's a lot of anxiety from the people coming in.
Yep.
They're uncertain about who they're mixing with, what they've come into contact with, and there's been a lot of confusion and I think sometimes misinformation in the media, which has made it challenging. So,
and has it been exacerbated with all the media noise of Newmarch House and Nepean Hospital being so close?
Yeah, and look, the media love a good beat up at any time. Like, it sells newspapers. So yeah, it really has, because we're local and because we've had some primary schools as well that have been affected.
Yep.
But, you know, the message is consistent. Stay home, stay safe, and if you have any symptoms, come and get tested. Yep. It's what we're there for, and if you're really not sure, then we can give you some guidance there.
Yeah. In the early days, at least, of the outbreak at Newmarch House, you were going there and you were involved with the testing taking place there?
I had some small involvement initially. Yeah, it was good to be able to help, but it was a very challenging time for them, and you know, they were doing their best. They really were. They were doing everything they could to keep people safe there, but there's a lot of unknowns with this virus. Very hard.
Yeah. And so the community nursing, what does that look like? What does that involve or entail?
It's different every day. It's pretty dynamic. So I see 8 to 12 clients in a day, and I go into homes. I'm primarily dressing chronic and complex wounds and giving medications, intravenous medications. So it's really interesting, but these are people who, aside from people like me coming in, really have been able to self-isolate. So It's given a different level of responsibility to me going into those homes.
Yep.
Being pretty lucky in Australia, but yeah, that's been a challenge in itself to make sure that I'm not a carrier of anything.
Yeah, so the anxiety hasn't been so much what you might get from them, but making sure you're not going to negatively impact them.
Because there's a lot of comorbidities in there. People are dealing with, you know, terminal illnesses and a lot of complex issues, and it's, yeah, definitely. I have felt like I could potentially be the link in a lot of those situations. Yeah. And then that's impacted too on the family and the kids to make sure that they're not putting themselves into positions where they might bring something back to me as well. So
have you made decisions as a family based on that?
Yeah, we've been lucky in a sense because things have slowed down for Glenn, so he's been home with the kids, but absolutely the people we have allowed them to come into contact with, even with Glenn taking the kids shopping with him as much as possible, and also my systems coming home, getting changed. The kids don't touch me before I've gotten changed and gotten in the shower and dumped my uniform and things like that. It's easing off a little now, which is good as we can kind of see a slowing. But
coming home, you have a whole cleaning process.
Look, you know, you can always do better. But particularly in the early days where we really didn't know how it was going to take off. Yeah, it was shoes off at the door with Clinell wipes, and then no one speak to mum until I'd gone into the laundry, jettisoned my uniform, and then had a full top to toe shower, and then come back in clean clothing, and then you may hug me. So you know, but they were great. The kids were great.
I know you've got a couple of puppies. How did they cope with not saying hi to mum on the way through?
Our dogs are quirky anyway, so they coped as well as they do with life in general.
They're not quirky, they're awesome. I love them. But
They have some issues that they could probably do with some therapy and Valium. But small dog syndrome. They coped as well as they do with anything in life, which is with a lot of barking and excitement. But they were fine. Yeah, it's been good.
And so going forward with the whole COVID thing, what's the feeling in the clinic with where things are at?
Look, I think as nurses, we are just waiting for the second wave.
Right.
I hope that we can trust ourselves, not as nurses, but as a society, to do well when everything opens back up. But what we're seeing in other countries is a second wave. And maybe we'll get lucky, and I hope that that's not the case. But with flu season on us, I suspect that we're a long way from the finish line yet. Not even with COVID, but with the anxiety just surrounding, unwellness, and how do we treat that when it might not be COVID, but it might be COVID, and maybe it's just a head cold, and at what level do you treat that? But I think we'll be around with the testing clinics for quite a few months to come. Yeah. Which is good. It's good we're available for that.
Yeah. And have you had? Careful of what we say, I suppose. Some interesting clientele at the clinics, unrealistic expectations maybe?
I work in the community, and in the clinic the community comes to us, and as a congregation, anyone who has been involved in community would know that there's always an element that keep it colourful. But a lot of that can be alleviated with encouragement and some love. People are nervous and anxious, and that outplays sometimes aggressively. But if you try and look past that a little, and people are scared, and they're scared for their jobs and what it means if they have to take time off. And I'm a casual employee. I understand if I don't work, I don't get paid. And when you're telling people they might need to self-isolate for 2 weeks for a reason, that's really scary for people. So we've tried to it's debriefing sessions are always interesting, but predominantly people have been really good, really kind, and really thankful, which has been kind of an unexpected bonus.
Yeah, it's something we've generally managed pretty well in Australia. When we've got to bind together and join together for something big, we do well. Yeah,
people are good, people's hearts are kind, and I think we've seen the difference between what we've seen in the USA and here, with people using their liberty here to stay home and protect communities rather than demanding that liberty be used to go out despite the risk to community. So I'm really grateful for that as an Australian. Very grateful. Yeah.
Well, we're grateful you could spend some time with us on the couch. Thank you for joining us.
Thank you, sir. Thank you for having me.
Thank you for the service that you give, and please pass on our appreciation to those that you work with at the clinic, and thank them for their service of us during this time.
Oh, I will. Thank you.
Thanks,
really
Peter.
kind, Adam. Thanks. Bye.
Ladies, thank you so much for sharing your insights of what life has been like for you working through this period of COVID. Thankfully, in Australia, we have been really blessed at the low numbers of infections, and particularly the low numbers of deaths. Tonight, we're going to go out with a parody of Staying Alive, the old Bee Gees number. People have had some fun with ripping off songs. You can find plenty of them on YouTube. I really enjoyed this one. I hope you do. Look forward to seeing you next week on the couch, 8:30 Thursday nights. See you then.